A burn injury that takes longer than 14 days to heal conservatively or requires a skin graft is at greater risk of developing into a scar. Scarring post a burn injury can impact on a person's function, cosmetic appearance and comfort levels, which all influence quality of life. This two-part video will outline principles of the treatment and management of scars, with part 1 including recognising a hypertrophic scar, pain and itch, massage and moisturising, and contact media. And part 2, pressure garments, scar maturation. These 3 modalities are commonly used in conjunction with one another. Hypertrophic scars are the most commonly recognised scar following a burn injury and develop as a result of a build-up of collagen. They are usually dark pink, red or purple in colour, are raised above the level of undamaged skin, and are thickened and hard when touched. When placed under pressure, the hypertrophic scar will blanch to a lighter colour, indicating decreased blood flow in the area. When released, it will return to its darker colour. Hypertrophic scars generally increase in activity in the first 6 months, where they may fluctuate in their colour, height and pliability. These changes can continue for up to 2 years. It is during this time frame that they are referred to as being an active scar, and the use of conservative treatment methods, such as massage, pressure and contact media, are most effective to maximise a person's long-term outcome. Changes in skin colour, also known as pigmentation following a burn injury, can occur in the presence or absence of scarring. Genetics, skin type and depth of burn can impact a person's skin pigmentation. Hypopigmentation is when the affected skin is lighter than the overall skin colour, whereas hyperpigmentation is when the skin colour is darker. Time and sun protection are currently the only 2 conservative methods for managing changes in pigmentation. It can take many months for skin colour to settle, and changes in colour may be lasting. Furthermore, exposing hypertrophic scars to the sun can make them permanently darker. Along with functional and cosmetic changes, scars can cause pain and itch. Itch is extremely common following a burn injury, especially with the development of hypertrophic scars. It can start as early as a few weeks post the injury and continue long term. People who experience this often talk of the itch worsening at night time, during or after exercise, and in hot temperatures. When required, pharmacological treatments are generally commenced when clients are seen at the Victorian Burns Unit, and they are linked in with their local GPs for ongoing management and weaning. Despite medications, itch can be difficult to manage, and other measures, including massage, moisturiser and pressure therapy, are often used in conjunction. These will be discussed within these videos. Although there is limited evidence in the use of massage and moisturiser, these modalities continue to be implemented by burns clinicians for ongoing treatment of hypertrophic scars. Massage aims to break up newly formed bundles of collagen and soften the developing scar tissue, whilst moisturiser, which should be non-irritant, fragrance-free and water-based, such as sorbolene, aims to keep the skin hydrated and support with the friction of the massage. The therapeutic nature of massage and moisturiser has been found to assist with reducing clients' hypersensitivity itch and pain associated with their scars, as well as benefiting their psychological well-being by improving mood and reducing feelings of anxiety. Using gloves as a universal precaution, massage and moisturiser can be commenced once the wound is healed. The technique should not be used on fragile or broken skin. A person's dermatological history and preference to moisturisers should be considered. Minimal moisturiser is needed, as excessive amounts build up on the skin and can result in folliculitis and skin breakdown. Scar massage is generally performed twice a day, building up to 10 minutes at a time. The pressure should be firm, making the skin blanch, but it should not cause shearing that can lead to breakdown or blisters. Different massage techniques may be used. The combination of cutaneous hydration and mobilisation is common, where moisturiser is applied and a circular motion is used over scar adhesions. Resistant scars can be managed more assertively with increased pressure from the fingers or using the knuckles for deeper force.
I can actually do a pinch and roll to try and get into those sort of deeper, firmer sections.
A longitudinal massage along the line of contracting scar when the joint is at end of range aims to assist with lengthening the tissue. Educating the client on these massage techniques is key to them becoming independent with completing their own therapy program. Ensure moisturiser is wiped off the skin with a damp cloth prior to the person donning their pressure garment, as moisturiser can weaken the garment. Excessive moisturiser and poor skin hygiene can also create a build-up of product, creating risk for potential breakdown and folliculitis. The use of silicone over hypertrophic scars have been found to improve pliability and elasticity. The product is to only be used on scars that are fully healed for a minimum of 12 hours a day and can be applied for the time that a scar is active, for up to 2 years. A piece of silicone can generally be used for up to 6 weeks. It is recommended to commence applying the silicone for 4 hours a day and slowly build up to a minimum of 12 hours. It should be removed when exercising to reduce excessive perspiration under the product, which can increase the risk of skin breakdown. Silicone can be worn under pressure garments, held in place by Hyperfix, or a fabric-type silicone, Silentex, can be sewn into custom-made garments, as directed by the burns unit clinicians, as a way of combining the two modalities of pressure and contact media. Uncommon adverse side effects include rashes, skin breakdown, and a foul smell. Often this is because the product and skin are not being cleaned effectively. Silicone needs to be washed daily in between use. If side effects occur despite adequate cleaning, the product should be discontinued.